A very warm good evening to one and all present here who are gathered here for today's session. Today, I take great pride in welcoming Dr. Yogesh Subramaniam, sir, Assistant Professor, Institute of Internal Medicine, Madras Medical College. He has joined us for the Medicine Career Compass 24 series. He will be discussing about general medicine as a career. I'll be asking a few questions along with Dr. Raghunandan. And viewers, you feel free to post any questions in the YouTube chat section. I'll make sure it will be asked and sir will answer it. Good evening, sir. Very happy to
Good
have you
evening,
here.
Dr. Patigan. Yeah.
I request Dr. Raghunandan Ramanathan to start the session with the first question.
Good evening, everyone. So thank you, sir, so much for joining with us today. It is a pleasure for us to have you here. As you all know that we are in a stage of time where we have to decide towards which path we are going to go for, say, towards a medicine, towards a surgery, in medicine, towards a general medicine, or towards any specialized branch like chest medicine. We have lots of confusion. And to clear that, to give a brief idea about which path you are going to choose, this career guidance session was started by Medusane, and I thank Parthiban for leading it excellently. So today, I thank Dr. Yogesh sir for accepting our invite and joining us with us. Uh, we all know that this general medicine is a cherry among all the branches. So if you see from the top 100 All India rank, most of them either go for radiology or general medicine, and that's where general medicine lies. So for first and foremost, we have to understand that it is not just we are choosing because other rankers have chosen already, but to understand whether we have to choose it per se, will it be suitable for us? Everything has to be considered. And for that only today we are going to have this session, sir. And as I told, the first question to you as I wanted to ask is, what motivated you to pursue a career in general medicine, and how did you decide that this was a right specialty for you?
Okay. Thank you for the beautiful question. So, in order to answer Dr. Raghu's question, first we should know that why we have taken the field of medicine, the why the interest came to us, why we were pushed into this field. So, as we all know, we all in the field of medicine, we have joined MBBS because there will be many reasons. One will be our self motivation. Second will be our parents' motivation. Third will be maybe the younger generation or our teachers. Someone would have motivated us. So once we finish our MBBS, we are entering into our post graduation through NEET as per the current guidelines. So we have to enter through the NEET only. So what made me to come here is, as a whole, we can see a single patient from top to bottom, and we are the first responders. Like our emergency medicine department, we are the first point of care. So in order to diagnose any kind of disease existing in the body, so the physician should be alert, and he must have a thorough knowledge in order to pick up the findings clinically with supportive evidence of our laboratory investigations. We come to a conclusion, and then we can refer the patient wherever we want to go. So that spirit and that motto is first with the physician, who is the first point of care. Point of care means the contact person for any patient in our general public. So actually that made me as a good physician till now.
Okay, sir. We'll go to the next question.
Yeah.
Thank you, sir.
Can we?
Yes,
Yes,
you
yes.
can.
Sir, every branch requires some prerequisite skills, no, sir? So, according to you, what are the key skills and qualities that will make someone a good general physician? What are the
Yeah.
qualities we
First,
should have?
yeah. So currently, what our CBME says, one is knowledge, second will be the skill, third will be the communication. I'll put in the opposite way. First will be the communication part. As physicians, we need to talk to the patient in their own language, as well as we need to explain the patient conditions in their own language. So the communication part is the first and foremost skill that every general physician has to learn. Second will be the skill demonstration. For a simple example, I would suggest is checking a blood pressure, checking the pulse rate, checking the JVP, whatever it is. It can be any kind of skill from top to bottom. Second will be the skill demonstration, and third will be the knowledge part. Because as professionals, we are going to learn each and everything day by day. It comes through the experience only. So knowledge is what we are going to learn every day till our lifetime. So this will be the order of preferences of the various skills what we need to learn as a MD general physician. Okay, so the first will be the communication part. The second will be our skill domain, and the third will be the knowledge part.
Thank you, sir. Now the question is, how has the field of general medicine evolved in the recent years, and what is your foresight how the trend goes? Because now, as you know, everyone have this one question in their mind: will my branch will have a scope in the future, and how will be my future after taking this branch? So your insights on that, sir.
Yes. So everybody they think that MD general medicine is not at all sufficient at this stage. I see every postgraduate who's entering in my department, especially when we ask what do you want to become after once you finish the MD degree. Most of them will tell like endocrinology or medical gastroenterology, something. But we need to understand that MD general medicine is a very, very, very big subject. You have various cases what you can see and you can make diagnosis. A simple example what I would give is this happened recently. An old man, okay, around 65 years, he was brought to the casualty in an unconscious state. He was done all other investigations. Finally, the doctor who was sitting in the casualty, he couldn't diagnose what is happening to the patient. Finally, they want to rule out a cerebrovascular accident, that is stroke. But they didn't check the basic capillary blood glucose, which was very low and 45. And finally, hypoglycemia was the diagnosis, which was missed. This could be picked up only when the physician plays an important role, where he will see from the head to foot, thorough examination clinically, and then added an investigations, we could make a clinical diagnosis rather than going into CT, MRI, or so many things. So we have to understand in our insight that general medicine scope is very, 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 very excellent. Okay. Second point is you need not stop from MD general medicine itself. You have various sub specialties after you finish. So the scope for MD general medicine is very, very high, because now it is the fever era, COVID era, influenza. You would have been seeing in the television and the radio where they telecast. There is flu-like symptoms which is there in every district. So the first point of contact is going to be the general physician who is going to make the clinical diagnosis. So it's an evergreen subject, evergreen field. So there is nothing negative, like this is the end, nothing like that. With MD physician itself, you can shine well.
Thank you, sir.
Okay, sir. Thank you. The next question is, what is the most rewarding aspect of career in general medicine, sir? What do you feel it is most rewarding?
Yeah. So as I told already, we are the first contact for any patient. being it is a fever, it can be a gastroenteritis, it can be a stroke, it can be a myocardial infarction, anything. So we are going to be the first point of contact for any patient. And when they get treated well with a proper diagnosis, the appraisal what they give will be the most rewarding point rather than what we get a satisfaction of treating the patient. So the patient gets immense pleasure when they would have been diagnosed with some disease and exact treatment has been started. The patient is doing well, he gets discharged well. So that is the most challenging part of the MD physician field. Rather than diagnosing a rare case, presenting a rare case, that is something different. But the reward will be what we feel after the patient gets resolved completely by the clinical diagnosis and appropriate management. So that will be the most rewarding point here.
Thank you, sir. And last question from the career point of view, what challenges do general physician like you commonly face once they come out, and how can one prepare to handle them, sir?
Okay, that is based on the career you're asking.
Yes, sir.
Okay, so most of the time we'll be left out with our MD degree. As I told, there are various subspecialties and fellowships where you can undergo after your MD degree of general medicine. You will not be left out at any point of time. You'll be attached to all the subspecialties. You have to think that either it could be a cardiology or neurology or hepatology, whatever it is. They all come under subspecialties of general medicine. Okay. Sometimes people call it a super specialty, but all other fields are subspecialties of MD, general medicine or internal medicine. So career wise, when we think, you will not be left out at any point because the boom of the patient is hypertension and diabetes. Only when you treat the diabetes, hypertension, or the chronic kidney disease, anything from the physician point of care, the patient will be attached with you lifetime. If we don't treat the patient well with those ailments, the patient ultimately doesn't come to you for the second time. So that is the most challenging part whenever you send any patient to a cardiologist or a neurologist or a nephrologist. If you are going to handle the patient in a good way, they will be attached to you till their lifetime. If we don't communicate with them properly, ultimately they land up with some other physician or they can just follow with our cardiologist or nephrologist or neurologist. So that will be the most challenging part being as a MD consultant or physician.
Okay, sir. Now we'll move on to that residency phase of general medicine. When you're doing residency, uh, what do you think is the most challenging aspect of your residency, and how did you overcome it, sir, during your PG days?
So when we take our postgraduate, everybody know that it's a 3-year residency program everywhere. So as usual, when first year enters, all the activities of the ward just lies on the first year. So in order to overcome that, we should be strong enough to handle first. We have to believe that all the patients in the ward are our own patients, our own relatives, our own friends. Only if we think in that way, whatever the crowd, it can be 40 admission, 60 admission, 90 admission, we'll be able to manage. Otherwise, doing continuous duties, maybe alternate days or 2 days once, 3 days once, will be very, very fatigued. Our mind will not work. So initially, when you join as postgraduate in MD General Medicine, the first and foremost is you need to take care of yourself. Sleep at least 6 hours per day. If you have any difficulties, please open your mouth and talk to your seniors or the unit assistant professor or the chief. Please do not keep anything inside your mind alone, please let it out so that we can sort the issue and give the best to you. Okay. So that will be the most important point I could tell when PGs initially join us the residency residentship. How to overcome it by frank way of speaking out with the colleagues or with the juniors or your seniors, whoever it is. So bring it out to someone who makes it to attention. This can be sorted out when there is open communication from the residentship point of view.
Okay, then. Sub question from this.
Yeah.
During what is the maximum number of OPs you saw during a day, sir? Just out of curiosity.
Yeah, maybe I did in a government institution, Government Stanley Medical College. So there, approximately we'll handle around 600 OP per day. So individually, when you calculate, it will be like 50 to 60 OPs in that particular over a period of time, like 3 hours, 3 to 4 hours. So it again varies where you take. That I think we'll cover later. But to your question, it will be like 50 to 60 OPs in
Okay.
that 3 hours of time.
Okay, sir. Hello. Can you hear me, sir?
Yeah, I can hear you.
Yes, sir. Thank you. And my question next to you is, sir, as you said already, managing the workload and stress is something that everyone has to learn during their residency. Sir,
Yes.
how a resident can strike a balance between the learning, patient care, and the busy clinical environment? And in this aspect, what resident commonly makes mistake and what they can be avoiding during their residency? Because I know that you as a SR and as a AP now you will be seeing a lots of PG residents, those who are joining you in your unit, and as we all know, you are the pillar of support and you are the pillar of support to the MMC students. So from your point of view, I think we can get a more clarity. The present gen who is going to enter into the residency can get a clear guidance on what is a mistake they are doing in balancing and what can be rectified.
Yes. So that's a wonderful question. Like everybody, after they complete their NEET exam, they'll be in like hyper activity. I'm going to enter some college. A simple example, we'll take it as a Madras Medical College, where it is the state of art in our Tamil Nadu. So there will be a lot of cases. There will be a lot of sick cases referred. But what our PGs think, every patient, whoever is referred to MMC, will be like very stable, or the workload will be satisfied. But it is in the opposite way. It will be like 70 to 80 admissions per day. Almost 20 cases will be sick. In that 20 cases, 10 cases will be on ventilator. So that is how we receive cases from all over the district as well as state. Even we get from other districts also. So we have to have a balance between the patient, the skill part, the knowledge part, as well as our own self care. What mistake our residents does is when they enter the first year. Number one is they get oriented very late. At least 3 to 6 months of time is required for their orientation, like how to do the duties, how to talk to the patient and the patient attender. In this current scenario, it's very difficult to convince the patient as well as the patient attender. As we all know, we are seeing a lot of medical legal cases day by day. So fresh from CRMI, they take a break of 1 year and sit and study. All those are the barriers where communication skill will be very low with them. So first and foremost, they have to develop the communication skill, properly explaining the condition to the patient as well as the attender. If they communicate properly, everything gets sorted at that point of time itself. So what mistake happening here is workload is heavy. They don't speak to the patient as well as patient attender properly. They just tell like this is the problem with one or two words, and that makes the patient and the patient attenders to ask more and more questions. During that time, the residents they get restless. They shout back. So this is the first mistake they does when they initially enter any college. Now I'm not only talking about Madras Medical College. Any college where they enter, they should have the courtesy to talk to the patient as well as patient attender in a polite way, and this will build up the rapport. Majority of the medical legal cases can be avoided if this communication part is nice. Second thing is they don't eat proper time. They sit in the ward because of workload. They do all the procedures or investigations till evening. They go to bed very late. They don't eat, especially in the morning time. They don't eat at all. Many a times I used to call, "Have you eaten today?" Many of them tell, "I have not eaten today." Then take some 15 to 20 minutes break. You go refresh yourself and come back and you continue. So that is the second mistake they do. They don't take care of themselves. The self care is very, very important. The third thing is the fear of declaring sick patient into death. So that will happen almost in all government colleges where death will happen at least one or two per day, because sick cases they will be referred to government institutions. So they should have a strong mind and power to handle these situations, because when we declare death to the patient attender, their reaction will be very, very harmful to us. So in order to handle that, they should again develop a good mind and strong mind to handle those situations. So these two or three situations is very, very commonly observed in all the residentships uniformly when they enter into post graduation.
Okay, sir. Sir, in recent times there are many there is a mushrooming of many private medical colleges all over the country, sir. So many are preferring to take PG in the private colleges. So if a candidate scoring, what and all factors should they consider on opting between a government college and private college? What are the pros and cons?
Yeah. So first I will talk about the pros. When you compare government and private, the case load is vast. Government as well as private. Number one is the case load. Second will be the skills. You can learn the skills even within a month with a lot of cases. Private, it is based on the number of cases which the resident are engaged. Certain private colleges have a separate academic wards where the student can learn from them. But in certain colleges, they are not allowed to examine unless the professor or assistant professor is with them. So that I would consider as a con only. So whereas in government setup, that issue is not there. You can do and examine all kind of cases because they are given a free treatment. So students should be benefited when they get a free treatment in government colleges. So that is a good advantage over private as well as government. Third is, as you all know, the fee structure that I won't enter into detail, but that is one of the cons. Final will be the outcome of the postgraduate. Government institution, they tend to learn all kind of skills within that 3 years of time. Private, still you have more and more chances because all the private colleges and private hospitals, for example, DNB also you can take into account. They have a lot of investigations and like CT or MRI or any kind of investigations. They have developed a boon to the society. So they learn more compared to government medical colleges. So that is one of the pros you can see when you compare these two kind of colleges. All the equipments, all the investigations, everything is well planned in all private medical colleges at present. Government is also doing equal at present, but still comparatively, private is superior in case of investigations and further drugs and treatment.
So
Thank
you're
you, sir.
saying private is more, private will be even more effective, sir, if money is not an issue.
Yeah, money is not an issue. Private at present will be good if the patient load is good. The only thing
Yes.
is how we can learn in our residencyship is only with the patients. Books will not teach us anything. So the more and more patient load, the more and more you gain confidence in treating the next patient. So good patient load with good investigations at present, because now it is everything is evidence-based medicine. So you need to show some evidence before you start any kind of drugs. So at the end, clinical medicine plays an important vital role. In addition, investigations is also needed at present to start any kind of special treatment. So comparatively, both are good except the fee.
True, sir. So in that case, it's an additional question to you, sir. So now, as people are like in a confusion to choose a college for
Yeah.
general medicine as a career, what are the aspects that they have to look for as a checklist so that when they are inquiring with the PGs, when they are inquiring in person in a college, what are the aspects they have to see? For example, as you have already mentioned, we have to see a caseload. This outpatient number of outpatient cases is a definite condition. So like that, we actually have to see a checklist. And what is your opinions, suggestions that need to be there in their checklist while they are inquiring?
Yes. So number one, as I already told, it will be the outpatient. Once when you get cleared with OP, you get more confidence in treating day by day. So that is number one. OP case load, at least each postgraduate should see minimum of 30 to 40 cases in that allotted time. Then only they will gain more experience as days goes on and years goes on. So the first in our checklist will be OP, second is IP. IP will be per postgraduate, he has to see at least 10 cases minimum in a week. So that he'll be covering all kind of systems in that 1 week. The next week, he will be following this case as well as he'll be seeing the new case. So minimum number will be like minimum 10 cases he should see in that whole week. That is not a big burden at all. Just 10 cases. Super. It's like a good thing. 10 cases is minimum for a postgraduate. That too, MD physician, he has to see. The third will be the hostel facility. Hostel inside the campus will be more like important thing, because as physicians he'll be called at any time in case of any kind of emergencies in the ward. Could be breathing difficulty, it could be a chest pain, anything, giddiness. So he's the first point of contact. So hospital attached with hostel will be a preferred one. Okay. And finally, as I already told, the kind of investigation they do, being it biochemistry or a pathology, if they have more and more postgraduates in other department, it would be very nice if they are considering that college to be joining as a postgraduate.
Yes, sir. And one more additional question in this same aspect. So we have got from one person that they have got 4,321 rank in MD and wanted to pursue MD general medicine. And
Yeah.
what she wants to understand is actually he or she is not so good at surgical skills. And is surgical skills necessary because she doesn't like surgery, so she want to take medicine? So is there a, again there is any relevance with surgical skills requirement when they choose medicine?
Not at all. There is no much surgical skill needed in MD general medicine. Only thing is they need to do some proper techniques of some tappings like ascitic tapping, pleural tapping, intubation, central vein, that is central vein or a femoral vein. Nothing beyond like you need to put sutures, you need to have a good skill with your hands. So those things is not expected in general medicine. Only thing is they have to do the simple techniques in a proper way. That's it. Nobody is going to tell like you have to do it exactly like what a surgeon does. It's not like that. They can perfectly choose MD physician if they don't like MS general surgery.
Okay, sir. So, last question about the choosing colleges. So, you studied PG in Madras Medical College, which has a
No,
very
no,
great
in government Stanley Medical College.
Stanley Medical College. It had a very great reputation. So, is there any difference between the students who studied in a reputed college like Stanley, that too in a metropolitan city like Chennai, and someone studying in a peripheral government colleges or private colleges in the rural areas? What will be the difference and what will be the difficulties faced by them? What
Okay.
should they do?
Yes. So we need to understand one important thing. In this 3 years of residentship, we will not be able to see all kind of cases, whatever is there in either Harrison or Davidson or any other textbook. It is going to be impossible. So this 3 years of residentship is only for all the basics to be learnt. All the whatever the skills I have told, communication, the skill part, the basics of all the knowledge. These three will be considered in this 3 years. After you complete your MD degree only, you will be learning more and more knowledge, more and more skill as years goes on. Just 3 years of residentship is not at all enough in order to learn, and you cannot master in MD general medicine within 3 years. So, coming to your question, being in a metropolitan city like Chennai or being in South colleges or
Sir,
any peripheral college.
Sorry to
Yeah,
interrupt, sir. We have
yeah,
one more, in addition to this question, if someone gets a college out of the state, like in Karnataka or Kerala, there
okay,
will be a language barrier. Will they
okay,
face any difficulty apart from that? And how can they manage that, sir?
okay, I'll come to it.
Okay.
Yeah, so being in periphery colleges, for example, when we take in our state alone, Tamil Nadu state, there are new medical colleges like Ramnath district. You have a medical college. You have Tuticorin, very peripheral college. You have Kanyakumari, very south college. So in these colleges, you have some local diseases and local poisoning and local toxicology problems in that area alone. Being in city, we don't see much of snake bites. Whereas when you go to south, you will be seeing in and out snake bites, which metropolitan guy will not face. He is not so confident enough to treat those cases being in Chennai. Whereas being in our south zone or in any periphery colleges, they will be handling in and out all the different types of poisoning which is available locally, or it could be like snake bite or scorpion stings, which is more common in their area. So it is not like that we can compare the metropolitan city guy as well as the peripheral guy. So it is not at all possible, just like that, we can compare these two colleges. It is based on the experience what they learn in those 3 years. So the kind advice is whatever cases is coming to your hospital in your area, please get trained well. If you don't see other kinds of cases, or you are not confident enough to handle those cases, please get trained after you finish your MD residentship by 1 or 2 years, practicing in opposite way. Like being in Chennai, he can go and work in some other peripheral hospitals where he can learn all these things. A postgraduate where he is working in periphery, that is studying in periphery, he can come to Chennai and learn other techniques. So that is why the senior residentship was introduced for 1 year after you complete your post graduation. So all the PGs can utilize this 1 year of SRship in any medical colleges where they can learn all the skills whatever they have missed in that 3 years. Coming to the second question, the language barrier. Language will be difficult in the first 3 months. I have a junior who's studying in one of the private colleges in New Delhi. He doesn't know even a single word of Hindi when he joined in that college. But when he started practicing and talking to the interns, he gradually developed the Hindi language within 2 or 3 months. And now he is masters in Hindi. He's in such a way that he know every other words and he is talking like our own language. So language barrier is not at all important thing. People in Tamil Nadu can take Karnataka or Kerala. You can learn the language within 1 or 2 months, even just with your interns. Not at all a big barrier. That is what my opinion. Language is not a barrier for our studies.
Thank you, sir. It's indeed a good lesson or a good advice from you, because many of them are in this dilemma whether they can get out of their state, whether they will be like culturally, language barriers, all these things, will they be able to overcome? This was a question to which was asked by everyone. I guess this will help everyone. And my next question, sir, probably the last. Before question or three questions or so more. So kindly, if anyone have any doubts or anything, can just start posting in the group so that that will be clarified at the end of the session by sir. So, as we have discussed already about choosing the right college or choosing the residency branch, etc. Now, after completing general medicine, what are the paths the people have? So, some may go for SRship, some may go for fellowship, or some even may go for sub-specialization, as you had already mentioned, or there can also be opportunities abroad. So, what are the various paths which a person can take? And probably the most important question to be asked by everyone, probably even to you, probably a PG, postgraduate who is studying under you, might ask you, how much I can earn after I complete this MD general medicine, and should I settle in a big or a small city? And how this technology, now we have a evolving technology like AI, telemedicine, etc., how all these are going to influence our field. So these are some questions which we have when we try to take a branch, right, sir? And I hope this can be clarified from you, sir.
Yeah. But Raghu has asked me so many questions. Anyway, I'll try to sort it out each question. So once you complete 3 years of residentship, you are blind now. You don't know where to go, where to settle. Will be in a dilemma. So service postgraduates will get some kind of postings. So we won't consider the service postgraduates. We'll come into the opposite, non-service postgraduates who take the seat through All India quota or any quota. Okay. So once you finish the 3 years of post graduation, you need to first select is what you are going to do next. Whether you want a subspecialty to be done immediately or you want to practice. My kind suggestion will be, as I already told, 3 years of residentship will not be enough in order to start a separate setup. So 1 year of senior residentship anywhere in your district, or it can be even in some other district where you can get exposed to other diseases and other kind of cases. You can go and practice for 1 full year if you have not seen much of cases in your 3 years post graduation. then you either start a separate clinic in your own native, or you can just move on to a city where you get more exposed to all kind of cases, or you can just work in the secondary care institutions. For example, a district hospital or a private hospital where they have some 50 to 75 beds occupancy. You can just practice there with the OP as well as IP. So 1 year, please practice general medicine wherever you want to practice. That is what my suggestion will be. Once when you finish 3 years post graduation, directly sitting for NEET super specialty and then going into the particular field what you want to take will be very, very boring, because next 3 years you're going to see only those cases which you have selected. For example, being it a cardiology or nephrology, only renal failures you are going to see. When you consider cardiology, only myocardial infarction and heart failure you're going to see. So the general cases where the boom is diabetes, hypertension, thyroid diseases, and all our endemic and epidemic and pandemic diseases will be like your flu, COVID, pneumonia, all those things. So only when you practice for this minimum of 1 year, you get exposed to all kind of diseases, how to treat, what drugs to start, what will be the complications for that patients when you start certain drugs. Because many a time we don't anticipate what complications these patients can get when we practice residentship, because the follow-up will not be there. Once when you start practicing outside, you will be holding the patient with you so that all the complications will be managed by you, and that 1 year will be giving you lots and lots of learning experiences by learning. So that is one type of learning after your residentship. So people who want to sit and prepare, you can, but the advice will be, please sit 1 year of SR-ship anywhere you want to do, and then learn the medicine in a proper way, so that it will be very, very helpful if you want to still pursue as MD graduate, or you can still pursue NEET SS by clearing the exam. So this is first advice I could give. Second will be big city or a small city. It is once again based on the candidate selection. If he is outer, that is periphery, or a very small village, or their area is very, very small populated, he can try a bigger city and he can learn much, and then he can start a small setup and he can gradually build up with that setup. Third will be how much we can earn. That is the most important part. Everybody will be looking into it. So being at a medical college, you join as a senior resident, or in a private hospital where you join as a junior consultant. Anywhere you join, the basic will be like 1 to 1.25 lakhs per month. It is based on your own experience and your own experiential learning, where you develop your skills slowly, and then you can upgrade yourself slowly. Every year you get your own increments gradually, because our field is not like IT profession or any other engineering, where our own friends, they sit with 1.5 lakhs or 2 lakhs per month. So our field is handling with a live patient. So please don't go into agony or don't go for depression. The first step is you start with 1 to 1.25 lakhs. Slowly develop yourself with your skills, gain confidence, and then you can start whatever you want to do next. Either it could be a super specialty, or it could be even a small setup in your own place. Okay. So any other question, Dr. Raghu? Anything else I missed?
No, sir, I guess you have covered everything, sir. Thank you so much. While you are saying, I just, today I had a conversation with Dr. Russell D'Souza, sir,
Yeah, yeah,
renowned
I saw, I
psychiatrist
saw.
from Australia. So
Mm.
the same thing he was telling. So when I asked him, sir, how much I can earn? This one point, like everyone else, I too asked, and the moment I asked him, the answer from him was, "You, this profession is unpredictable always. It is up to us with regards to
Yeah.
the skills and knowledge which we have that decides our income." This was the thing which he told me, and that's what quite in line with what you said, sir. Thank you so much. And
So
Parthiv,
regarding the fellowships, no, that I missed.
yes, sir.
So either they can choose the super specialty like cardio, nephro, neuro. There are a hell lot of subspecialties, or they want to stop with MD medicine. Many institutions like CMC Vellore and other private colleges, they have recognized fellowship courses. For example, CMC Vellore, every year they release diabetology fellowship course. That is contact as well as non-contact program is there. They have infectious disease fellowship program. Okay, so like that, many private institutions have their own fellowship courses. You can go into it. You can develop your skills as well as the knowledge based on your own expertise. So that is also one option. Or people who want to go to abroad also, you can go, no issues. You can write MRCP exams. Okay, you can prepare for the same at the same time USMLE exams. No issues at all. The main problem what we need to think is, first we need to decide where you want to settle. You want to settle in the same place where you were born, or you want to go to some other country and work? That is the first question you need to answer yourself and start preparing. Please don't ignore the 3 years of MD postgraduate in general medicine. That is very, 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 very basic and core to any subject, whatever you take, being it cardio, nephro, neuro, hepatology, medical gastroenterology, anything. If any patient comes with anemia, you are the first point of contact. So we should know well to manage and clinically examine the patient in case of anemia or fever, anything. It can be any reason, but we should learn all the basic skills in this 3 years of residency. That is what we need to learn in this 3 years rather than diagnosing uncommon conditions or very, very vague presentations that can be at one point or one corner of our mind. But what we should learn is the basic skills, the basic clinical procedures, and the basic knowledge about all the diseases. So with this three clinical skills, you can be mastering in any place or any hospital wherever you go. Survival of the fittest will be how much you do the skill, you see the patient, and how much you hold the patient in your OP as well as IP. Because the follow up of patients will be regularly coming only when you develop all these three skills at the same time. He may be a good practitioner, he may be having a good knowledge, but if his communication fails, the patient will not come. He can be a good communicator, he explains everything well, but he fails to diagnose a simple hypoglycemia, the patient never come back to you. So, like this, I can quote many examples, but you need to sharpen your mind in these three aspects. First is communication, second is the skill part, the third will be the knowledge part. Okay, so with these three skills, you can shine in front of anyone or in any hospital, wherever you go. You will be the first point of contact for anything you do, right?
Sir, talking about future aspects, Dr. Raghunandan has one more question. He's very shy to ask you. He's
Yeah.
asking, will I get a bride without super specialization? What is the
Again,
importance of super specialization?
that is going to be like still a question mark.
Yes,
But
because previous decade, if you see, it was a reverse one. Just if will I get a bride after without my post graduation? That question has now shifted
yes,
to
yes,
will I
yes,
get a bride before without super specialization? That shift has happened over a decade.
yes,
So
yes.
your comment on that, sir?
So again, I will tell, like, இது போதும்னு நினைச்சோம் அப்படின்னா போதும், இல்ல இது இன்னும் போகணும்னு நினைச்சோம்னா அது போயிட்டே தான் இருக்கும். So if your in-laws is going to expect you, my son-in-law should be a nephrologist, neurologist, like that, again it's going to be difficult. If their aim and target is just a post graduation is enough for survival of fittest, then MD general physician is a very, very good field.
Okay, sir. Thank you, sir. Sir, moving to the serious questions.
Yeah.
What is the role of seniors, mentors during residency?
Yeah. So now we have a lot of changes as per the new NMC, National Medical Commission. So where the assistant professor has to talk with all the postgraduates every week and then submit a report based on all the questions whatever has been discussed with them. So mentorship is again upcoming thing in our medical curriculum, where it was missed when we were doing the post graduation. So we don't know what is a mentorship or who is a mentor when we were studying, but now I myself is a mentor for at least 18 postgraduates and nearly 50 undergraduates. So that is how it has been segregated now. So the chief as well as the assistant professor will be the mentors till they finish their post graduation. At the same time, they have to develop a good rapport with their own seniors. So if they develop that good rapport and sharing things, sharing their experience, the difficult task what they are facing initially, things will be sorted out in the initial phase itself.
Okay, sir. Going to the last question. Sir, all of us from our field will say medicine is a lifelong learning. So according to that, how do you cope up with the recent advancements in our field, and how important it is for a lifelong learning and a professional development in general medicine, sir?
Okay. So whatever field we take, lifelong learning is the key to success. Coming to MD General Medicine, there are newer technologies as Dr. Raghu asked, what is the role of AI? I would tell AI can tell certain symptoms and signs of any patient and can come to a differential diagnosis. Simple example I would give is you put acute onset of cough with breathlessness, there will be some 10 differential diagnoses. But only when the postgraduate goes and sees the JVP, the pulse is regular or irregular, and the blood pressure, he will diagnose it. It is a cardiac issue and it is going to be a atrial fibrillation, where artificial intelligence cannot bring it to the point. So, my suggestion would be we need to upgrade ourselves in attending the conferences which is happening throughout the world. That is number one. Participating in CMEs, number two. Number three, wherever you join any post graduation course, there will be like every week academic programs running. And finally, some kind of AI will definitely help you, but not always. So these will help you in upgrading yourself to the latest technologies. Finally, will be the research and journals. So again, that is going to be upcoming field in future when you all guys join post graduation. So seeing journals, the latest type of treatment available, everything getting updated through the e-journal and reputed journals will be the source of upgradation of our knowledge.
Okay, sir.
Thank you,
Thank you
sir.
so much, sir.
Thank you, sir. As you have told, today I just as I told you, as I attended this AI conference, especially the last
Yeah.
point which you have told, it was beautifully told by Siddharth, sir, director of AIMS Nagpur. The person who is handling the AI is very important rather
Yeah.
than just telling AI can replace. There was a question actually asked over there. Will that, especially if already radiologist is under a fear of replacement of AI,
Yes, yes. Yeah, yeah, yeah. That is
on the
trending
advancement of
topic. Yeah.
exact and the advancement of AI, physician is also under the fear. And what is their opinion? This was asked from the audience side, and this one word I just it got attracted to me: a fool with a tool is still a fool. So he told this exact lines over there.
Yes,
So
yes, yes.
that summarizes the entire thing about the AI. So the one who handles is will still be important rather than talking about the AI replacing a physician. Thank you so much,
Definitely.
sir. And there was a last question from the side of audience: is how much important is thesis for MD medicine, and do state government colleges fund research as in INI?
Okay. So thesis, every student has to submit by the end of 6 months. That is, they need to select the topic of thesis by the end of 6 months of residentship. They have to get the ethics approval. They have to start doing, and they need to complete it before they go to the final year exam. Now, the current guidelines is either it gets approved or not, the student will be allowed to write the exam. This is what the current NMC guidelines says regarding postgraduate thesis. So you'll be submitting your thesis and one research publications. Either it is accepted or not, one you need to have separately beyond thesis. So thesis will be one compulsorily you need to submit. Second will be any kind of research. It could be a simple research or it could be an publication in your own university itself. So need not be external source. It can be your own university where it can get published or it is still in the approval stage. So thesis is one compulsorily you need to submit, but whether it is approved or not by the external examiner, that is based on their own opinion, but you will be allowed for writing the examination even if it is not approved. This is the final guidelines of NMC, latest guidelines.
Thank you so much, sir. It was really a wonderful. Thank you so much for your time and patience listening to all our questions and answering. It has been 1 hour since we have started this session, and I guess not just this year, but this video will be serving as a torch bearer for the upcoming generations to those who are willing to take general medicine. Gradually, we are conducting for every branch in the upcoming week, and generous faculty like sir is still coming forward to take, and we need to be thankful to him because among his busy schedule, as always sir is very much into the academics and into the students activities, and this session is going to be really a wonderful guidance for those who are willing to take general medicine. And on behalf of my team, and I wish all those who are interested to take general medicine to lead a wonderful career ahead after choosing the residency. And not just choosing a residency is our platform, but still, even after, if you have any problem, any doubts, we are there to guide you, and sir is always with us to support you all, whichever college you're going to choose. Thank you so much for joining with us today, and thank you Parthiban for organizing this wonderful sessions. And I hope we will try to bring in more faculties from other branches in the future before the counseling ends. Thank you, sir.
Yeah, thank you. Thank you, Dr. Raghu. Parthiban, thank you so much for
Thank you,
conducting
sir.
this.
Thank you so much,
And
sir.
one final thing I want to conclude is whatever the field you take, develop your own skills, get updated, then only you can shine in your own field. Okay. So that will be my final touch.
Thank you, sir. Thank you so much, sir. It's
Yeah.
always a
Thank
great
you.
pleasure
Thank you.
having you here.
Thank you.
Thank you.
Thank you.